All right. Good afternoon, everybody. This is Paul Lewis with the Eno Center for Transportation. I'd like to welcome you to the webinar this afternoon. Today, we're going to be talking about microtransit, which was the subject of a paper that Eno released in early January called UpRouted. Microtransit is something we're defining as, at least for this webinar and for our paper, as an app-based flexible route on-demand transit service. And it has been the topic of discussion in the public transit industry for the past year or so, and often talked about as a pilot and as kind of a new way of providing service. But in many ways, it isn't a new service. We've been providing and offering paratransit for decades via dial-a-ride platforms. But the app-based hailing and the advanced vehicle routing algorithms have the potential to make this more useful to the riders and more productive to public transit agencies. And several agencies have conducted pilots. This report documents the first few of those pilots, gathering information on their relative successes, their failures, and the lessons that they learned. It's not clear whether microtransit is a service that becomes part of the normal transit portfolio or it's just the transit hype buzzword of 2018. But what is clear is that a few agencies are going to test this service. And if they do, we hope that they read this report and follow the recommendations that we've provided. We're fortunate today to have two of the paper's authors, Emma Wong and Marla Westervelt, on the webinar with us to present the paper and its findings. Emma and Marla are both part of Los Angeles Metro's Office of Extraordinary Innovation, and they are embarking on a microtransit pilot of their own. They asked me to let you all know that due to their procurement rules, they can't discuss their own microtransit pilot or answer any questions about it, but they can answer questions about the case studies in the paper and the recommendations that they authored. After this presentation, we'll have time for some questions. To submit a question, please type it into the chat function on your GoToWebinar toolbar. You should all see that in front of you. If we don't get to your question, don't worry. We have over 250 people on this webinar right now, so the questions, I'm sure, will be plenty. And we will follow up with you if we haven't addressed your question directly. So without further ado, I'm going to turn over the presentation to Emma and Marla.
So thank you, Paul, and the Eno Center for having us on the line. I'm Emma Wong, and I'm joined by my colleague, Marla Westervelt. And I'm so excited to speak with you guys today about our research, and it's really great to hear that we have a large group on the line. So I think it's helpful to first explain who OEI is and what we do so you can better understand our motivations for doing this research. Our CEO, Phil Washington, established the Office of Extraordinary Innovation when he came on board in 2015. He felt that given the challenging mobility issues that Los Angeles County faces, it would take some extraordinary innovation to make things happen. And so he established our office and gave us a few functions to empower us to be an incubator and an implementer of innovative ideas in many ways. Within our arsenal, we have three broad functions. We have our unsolicited proposal process for the agency. This is a fairly new policy now, which allows anyone to submit an idea on anything to our agency, and then within a set amount of time, we will review it, determine if it has potential, and then decide whether or not we want to advance it to the next stage. So this comes from the idea that with traditional procurement, we don't know what we don't know, and so it can be limited. And so the UP process allows us to turn that idea on its head and to allow the private sector to bring us their ideas. And so within this process, we are particularly interested in capital public-private partnerships. The second tool that we have is we are tasked with creating Metro's agency-wide strategic plan. So this has been a large undertaking, and we've spent about the past year and a half interviewing stakeholders across the country, surveying our own customers, also those who don't ride our services, and our own employees to understand what we're doing well, what we aren't doing well, and basically who we want to be when we grow up. So the MSP intends to align Metro under one unifying mission and vision and establish certain initiatives and priorities of our agency. And the third tool we have is a research and policy arm. And so one of the functions of that is to look at what innovations other transit agencies across both the United States and globally are doing. And we want to know what they're doing, how they did it, what went well, and what didn't, and to identify leading edge concepts to test in Los Angeles County. So our research on microtransit is a great exemplar to illustrate how OEI functions. We initially received an unsolicited proposal on microtransit, and our strategic plan sets the vision and empowers us to improve mobility across the region and find new ways to do business. And so we were able to tap into our research team to look into how other public transit provider experiences, what their experiences were when piloting microtransit in order to learn from them. And so I'll just remind you that, as Paul mentioned, while both Marla and I are here to speak to you on the subject of microtransit, we can actually speak about our own pilot. So I'll move on to the next slide. As you all know, there's a lot of definitions and interpretations of what microtransit is or what it isn't that have been floating around. And so I think it's helpful to explain how we define microtransit in the paper. As Paul mentioned, the US DOT defines microtransit as a privately owned and operated shared transportation system that can offer fixed routes and schedules as well as flexible routes and on-demand scheduling. So the vehicles generally include vans and buses. And even within this definition, microtransit has many configurations. For the purposes of our research in this paper, we focused on flexible route on-demand schedule microtransit, in which a tech-enabled application, it allows users to request shared vans or buses in real time, and the vehicle will deviate from its route to somewhere within walking distance of the requester. So it's the innovations in technology and connectivity that have allowed these routes to be fully dynamic and adjusted in real time based on traffic, and they can change, these algorithms can change over the span of a few days, or can be live. So moving on to our next slide. In moving forward with our research, we recognize that the literature on publicly operated microtransit, as we defined it, is relatively limited, just due to how new these models are. And so we knew that we wanted to do case studies in which we did a series of interviews with the officials who were most familiar with these pilots. We wanted to gain their insight from the public agency perspective on developing and deploying the service. Questions that we were thinking about were, what were the obstacles and barriers they had encountered? What was their approach when defining this project? What were their motivations? And why did the project essentially turn out the way it did? And so we looked at Kansas City Area Transportation Authority, Santa Clara Valley Transportation Authority, and Alameda Contra Costa Transit. And so for the purpose of this discussion, I'll only be giving a pretty high-level overview of each case study, but I'm sure that you found more details in our paper, and I'm happy to take questions about that. So moving forward to look at KCATA's experience, when we spoke with officials, they really articulated a desire to test microtransit in order to better understand their own local on-demand market, but also to just be the first to actually demonstrate a microtransit public-private partnership. They partnered with Bridge, whose software was designed for commute patterns. And so because Bridge's software was limited to only serving commuting patterns, that's essentially what they tested. They tested it during peak weekday hours to and from a central business district, and the service could only travel in the direction of demand. And so on the screen, you'll see a map, and so service can be taken to downtown Kansas City, Hospital Hill, and a portion of the KU Medical Center, as long as you were traveling, again, in the direction of demand. And so when we looked at their ridership results, while the pilot was projected by KCATA and Bridge to provide about 200 rides in a day. Within the first 6 months, it had only provided about 600 rides total. While the ridership had grown in that second half of the year, close to about 1,500 rides, that constituted about 11 rides per day. And the pilot concluded with costs amounting to roughly $1,000 a ride. This has been widely cited across the media. And according to surveys of riders, of those who had signed up for it but hadn't actually used the service, 76% actually reported that they didn't use it because it didn't go where they needed it to go. 31% reported that it didn't operate when they needed to travel. If we move on to the next slide, this is on Santa Clara Valley's pilot. So they released an RFP for an on-demand and advanced subscription service with desktop and mobile application. Initially, they had wanted both, but once RideCell was awarded the contract and working on the application, they realized they were unable to actually have the on-demand capabilities. And so initially they were unable to have both, and so only on-demand was offered. The advanced capability was not offered. And early on, what really struck us was that VTA had recognized that they made the initial service area too small. So they wanted to expand it. However, it took them roughly 3 months to actually be able to go through the board approval process to expand the area. And once they did see ridership increase, but it took them 3 months. In terms of their ridership results, the pilot was discontinued after about 6 months because of the high operating costs and also the low fare box recovery. And they had about 0.4 boardings per revenue hour over the 6-month period. If we move on to the next slide, it's the AC Transit pilot. So they aimed to pursue this pilot because they wanted to improve the service in 2 low density and low demand areas. And they also wanted to respond to a changing marketplace. And they did articulate that it was really important to them to ensure access and equity. So they put out an RFP for a vendor to develop and implement a tech platform that could enable fully automated scheduling, dispatching, and a reservation system. And they awarded that contract. And in one of the areas, they used Flex to replace a bus route, and in the other area, they use Flex as an addition to its existing services. In terms of ridership results, as of November 2017, they had about 25,000 passenger trips taken on Flex, and they actually issued a staff report to their board recommending that Flex be permanently incorporated into its services. So our case studies, they led us to make a few takeaways and recommendations. We looked at how KCATA and VTA had initially identified having both the on-demand and the the on-demand as well as the advanced service option prior to actually determining who that private technologist was going to be. And it wasn't actually until after the vendor selection that the project design process and the deployment that they realized that they couldn't do part of that component, and that they hadn't actually identified the use cases. So we feel very strongly that agencies should prioritize their customer needs ahead of the novelty of new technology upfront, and should be pretty clear in how they want to move forward with their partner. For the second key finding and recommendation, we believe that agencies should should be able to fail fast and iterate quickly. Shortly after the launch of the VTA pilot, it became clear that the service area needed to be adjusted to meet customers' needs. They weren't able to do that due to some board processes, as I mentioned, and so their project was stymied in that way. We think that you should be able to set up yourself to be flexible and be able to make changes. If we can move to the next slide. A third finding and recommendation we made is that the vendor selected was not able to meet the requirements originally set out by the agency. So as I said, establish your goals up front, and even consider utilizing an innovative contracting approach to work with potential vendors to design a project within the parameters that you've determined up front. Lastly, all three agencies indicated that the pilots would have benefited from more on-the-ground marketing and outreach. This can be really tricky when doing a pilot. A lot of times there's hesitations because when you are doing a pilot, there's a lot of unknowns. So there's a fear of putting significant resources, such as marketing resources, into something that you don't know how it's going to turn out. However, that's a shortcoming that can be mitigated if you are very clear across the agency on expectations regarding roles and responsibilities and resources. So with that, Paul, if you want to open the floor to questions, I'm happy to take them, and Marla will be jumping in as needed.
Thank you very much, Emma. We have about 12 minutes or so for questions. Of course, we have a bunch of questions here in front of me. For those that have not yet, feel free to submit a question via the chat function, and I'll try to get to as much as I can. A question first, that kind of building on some of your recommendations. What specifically would you recommend to agencies to do differently than the three agencies in the case study that might try to make this more successful? Addressing the fact that there's a higher cost per passenger than fixed route, or higher ridership than a fixed route. Is it a larger service area? Is it lower wait time? Is it better marketing? I mean, what are some of the really big recommendations that you would do, or what you would say?
Yeah, thank you for that question. I think the first thing you have to do is think very clearly about what your goals are and what your objectives are in doing this pilot. We saw in our cases and in our literature that sometimes there was the idea to test microtransit before the use case for which microtransit might be useful came about. And so once you've identified your clear objectives and goals, then you're able to set yourself up for success because you then know what you're measuring.
Got it. Thank you. And one other question that keeps coming in, and I'll address it directly, is a few folks are asking for a copy of the report. It's available for free download on Eno's website at www.enotrans.org, or if you just search a Google search for Microtransit UpRouted, it should pop right up. Aside from that, the next question that I have here is, why does an agency need to partner with a private sector operator to provide microtransit rather than just directly operating it and innovating it themselves in-house?
So I want to clarify that all three of these agencies actually operated the microtransit service themselves. They actually partnered with a private sector technologist in which they licensed the software and the application capabilities to deploy this service. So it's a little bit of a nuance, but I think it's an important distinction. And I think that we're seeing transit agencies do this because we don't yet have these capabilities in-house. We have some hindrances due to our procurement, and we also don't have that technology. And so a huge appeal of testing microtransit are these innovations in technology that currently exist in the private sector.
So building on that, and this is another question that's very similar, is how did these agencies deal with the question of private sector labor, or did they not have to worry about that?
No, I think that they certainly had to worry about it. I think it's a concern that agencies face whenever they're trying to figure out a new service model. And when we did talk with agencies, they did acknowledge that there's conversations that need to happen internally when when these pilots were being designed, there is the consideration of, do we use our own labor, and there's ways that you can negotiate with those parties to make sure that you're trying to satisfy their concerns while also being able to test this new technology. In the cases that we saw, a few of them did actually find mutual ground and were able to train people to deploy this service. So it's definitely possible. I think it's a legitimate concern.
Another question that came up has to do with making sure that these kind of pilots are in conform with federal law, specifically the Americans with Disabilities Act. Do they need to conform with ADA and provide access to both people with and without disabilities? And if so, how did these pilots address that?
Sure. I mean, absolutely all services need to conform to ADA. I think the challenge is finding out what compliance actually looks like. The three agencies had different approaches for this. KCATA used two vehicles that were wheelchair accessible in their microtransit fleet, whereas VTA and AC Transit utilized previously owned shuttles and buses that were already wheelchair accessible. I don't think that there's firm answers regarding whether that's an equivalent level of service. I will mention that currently Los Angeles Metro is piloting the FTA Mobility on Demand pilot, which is a sandbox, and the FTA is allowing agencies to test a first and last mile service partnership with a TNC and to figure out, in terms of complying with ADA, what's in the realm of possibility. And so I don't think that there's necessarily clear answers. I think that everyone should aim to conform. I think that when it comes to having smartphone access, it's a little different in that digital access falls under EJ, which is an executive order. And so while you should still aim to find ways to serve all your customers, there's certainly pause when it comes to whether or not you should pursue a pilot if you haven't identified all those solutions. So we saw that AC Transit and VTA enlisted a call center for people, and KCATA wasn't able to do that.
Thank you for that. A couple questions came in about the use cases where microtransit makes the most sense. Where do you guys, based on your research, think that microtransit works best? Is it suburban? Is it rural? Is it urban? And what would in particular a rural microtransit case look like, particularly since that isn't necessarily covered in the pilots we looked at?
So I think it's really important that we make it clear that in high density, high demand areas, the fixed route bus is always going to be the best. In terms of identifying, based on the three case studies that we did, what arena microtransit is best suited, I don't think we have enough data points yet to determine that. I think it depends on the agency's goals for testing the service and how the agency defines success. I think you can look at AC Transit as an example in that they identified upfront having a vision for having a network approach to their service. So a network approach would be where they had a very frequent bus service on the major corridors, and then they have a flex service coverage on zones in which it's not as frequent. And so they had this vision, and they were able to identify microtransit as a potential service model that could be used to accomplish this vision.
Got it.
And then in terms of acknowledging the question on, I believe, is rural, what was the question?
Yeah, I mean, what would a rural microtransit pilot or project look like?
I
I personally don't think I've seen a rural microtransit pilot yet, but I think that there's a lot of potential there because obviously having a fixed route high capacity service in a place where there aren't many people is not going to be cost efficient. And I think it would look similar to the ones we've seen in more urban areas. Potentially you would need more vehicles in a larger service area. But I certainly encourage rural transit operators to test that out and send us the results.
So a few on that same vein, a few folks on the call have were a little surprised at the low ridership numbers, especially coming out of VTA and Kansas City. Can you talk a little bit about those really low numbers, and is there a way to incentivize the private sector partner to play a bigger role in making sure that they hit the targets? You know, for example, Bridge thought that they would get 200 riders per hour, and they got 600 riders in 6 months. So
Right.
how do we incentivize the private sector to live up to what they think is actually possible?
Yeah, so in the paper, we made some recommendations on ways that the public sector could ensure that when partnering with this private technologist, that they're definitely getting what they're paying for. We had suggested to use some innovative contracting approaches where you tie performance to compensation. I think if we were to try to answer why KCATA and AC Transit had low ridership, I don't think it's necessarily answered by one. I don't think it's one item. I think it's a number of reasons. But I think that this can essentially, public agencies can try to mitigate that by having a contracting approach that allows them to be very clear up front of what the expectations are in terms of ridership, and understanding that compensation is being tied to that.
Got it. So another kind of theme of questions that we have on the call, and I know we're running out of time here in a few minutes, but it's a lot of it is about what should we be measuring, and in the paper we talk about going beyond just ridership and fare box recovery and looking at a couple other performance metrics. And in the paper we also talk about really tying it to agency goals. The questions coming up are, well, what performance metrics should we be looking at? And what agency goals are particularly relevant to microtransit?
Yeah, those are all really great questions, and I think that is very relevant to ongoing debates that are happening right now in our industry. I think the jury is still out. What we do know is, obviously, when it comes to thinking about customer experience and enhancing that and feelings and perceptions of safety, that can be measured through surveying. That's a pretty obvious tool. But when it comes to other performance measures that maybe haven't been used as much or haven't been relied upon, such as, just improved mobility and things like that, that's something that I don't think we don't have clear answers to, but I think it's something that agencies such as LA Metro are currently working on. I mentioned our Mobility on Demand grant earlier, and that's a huge component of all of the FTA Mobility on Demand partners. We are thinking about that in terms of when we put together our performance measures for our pilot. And so I think that it's going to be an ongoing process and something that we'll continually be thinking about. Great.
And then I'm going to ask a last question here. You give 5 recommendations for agencies that want to pilot microtransit, but do you think this is something if every agency should be piloting, or is it just something that those that are interested in it? I mean, what would be some of your recommendations to other agencies around the country that are considering this?
Yeah, I don't think that every agency should pilot microtransit. I think that our paper, it serves to inform those that are currently pursuing microtransit, in that we want them to be informed by pretty much the lived experiences of the other transit agencies that have already done that. I think, though, that while I don't think microtransit is suitable for every transit agency in the U.S., I think it does need to be tested more so that the industry can better determine where it works best.
Fantastic. And on that note, we'll conclude the webinar. Thank you, everyone, for attending. I know I didn't get to everyone's questions, so we'll be following up with you. Feel free to send any further questions and read the report and let us know what you think about it. Let's all keep a very close eye on how these pilots progress over the next few months and what we learn from them, and see whether this is part of the future or if this is just an experiment we're doing for 2018. So we're very excited to be part of this conversation. Again, I want to thank everybody for attending the webinar today, and we will see you on the next one.